thank you everyone for the opportunity to come and take a bit of time in the forum to update you on our wider work as Health and Care Research Wales. And it's quite good timing to do that, I think, because we published our plan for 3 years, 22 to 25, earlier this year formally, although in fact it had been in fairly wide circulation for consultation for many months before that. And we've just completed a kind of review of how we're getting on. So I'm going to talk a bit about the plan and a bit about what we've been doing, essentially. And I've got, I think, about sort of 8 or 9 slides, and probably will take about 15 minutes or so. I'll try and keep it fairly brief. Really interested in people's views, comments, welcomes. I know there were a few questions that came in advance. If you haven't already seen our plan, I'm sure we can put a link in the chat to it. It's on the Health and Care Research Wales website. So this is kind of what I'm going to try and cover, say a bit about the background to why we needed a plan, give you a bit of an update on what we've been doing and how we're getting on. I want to be really kind of upfront about what are some of the challenges that we face, and then very much interested in people's views and responses. As I said, we published the plan in March, I think it was, of this year. And when we published our annual report in October this year, the Minister said some very nice things about the purpose of the plan. She had also previously endorsed it in her forward to the plan. But as I say, it's a plan for 3 years, which we really started working on as the pandemic came to an end and as we began to be able to lift our eyes from all the challenges of research in the pandemic and all the incredible achievements of research in the pandemic, and begin to think about business as usual and the longer term for Health and Care Research Wales. That's the document. I was really keen that it was going to be a plan, not a strategy. Not that I don't want to be strategic, but that I wanted it to be pretty concrete about the things we felt we needed to achieve and what we were going to try and do. I wanted it to be something that we could look back on and give ourselves ticks or crosses as to where we've made progress or not. I think we were also really keen to make the plan pretty upfront about where we thought we were in the state of play, what were the strengths, but also what were the areas for improvement. There were 2 principles, I think, that lay behind the plan. I want to say a little bit about each of these and explain them. One of them was, we thought it was really important to recognise that in the Welsh health and care research system, if you like, the ecosystem, the institutions, the players, the stakeholders, the communities, and so on, we have to be selective. We have to recognise that we can't do research on everything. And that we have to think about what we prioritise. And we've sought to focus on areas where we know in Wales we have strength in depth in research terms, and on issues which we know matter to the community in Wales. That's not always an easy balance to strike. There will be issues that really matter to the community in Wales, are really important research topics, but where actually the research is being done in Scotland or in England or in Northern Ireland, or indeed right across the European Union and in the US and Australia and elsewhere. So not all research has to be done in Wales for it to be really useful and important to Wales. That's one point. The other thing is we need to focus on areas where our researchers can be competitive. And that means them being competitive against, very strong research competition in the UK, particularly in what we often call the Greater South East, which is really Oxford, Cambridge, and London. So we need to be selective and pick our winners. Second principle that we worked on was the idea that we shouldn't compromise on our expectations of research quality and rigour, that we should expect great research done in Wales just as we expect that great research to be done in the rest of the UK and internationally. And we should be encouraging our researchers to play, if you like, to be part of that much larger research effort across the UK and internationally. And I think an underlying theme right through the plan is doing the best we can with the resources that we have, and therefore challenging ourselves in Health and Care Research Wales, but also challenging the universities in Wales, the health boards and trusts, social care organisations, other stakeholders and partners to raise our game. So that's kind of what lay behind the plan. The plan centered around what we're here to do, which is not rocket science. It's essentially we're here to try and promote, support, provide some oversight of health and care research in Wales to make sure it's great research, relevant to the needs and challenges of people in Wales and makes a difference to patients and communities. That's the sort of the purpose of Health and Care Research Wales. And we split that into 4 aims, which I'll just briefly rehearse, and the plan's organised around those 4 aims. So those 4 aims are, firstly, setting agenda and strategy, promoting the place of research, making sure research is up there in the priorities of all sorts of people and organisations in Wales. Secondly, planning and funding health and care research. That's not just our own funding, but seeking to make sure that other funders, much of the funding is at a UK level, other funders fund research in Wales. Thirdly, working to create and sustain capacity and capability in Welsh universities, in health boards and trusts, and in social care organisations. So, that's the capacity to do great research, which means thinking about researchers, careers, capability, equipment, all the infrastructure, if you like, that's needed to deliver great research. And fourthly, and really importantly, working to promote the use of research in innovation and improvement and leading to those impacts and changes that make a difference. I think we learned a huge amount during the pandemic about how research can absolutely make a fundamental difference to health and care services and to the delivery of care for people. And we kind of want to take that set of lessons into what we do in the future. So those are the 4 aims. Now, briefly on each one, just say something about what we're doing in each of those areas. So trying to set the agenda for health and care research, there's a lot we've been doing in this area. We have worked with boards and trusts to produce a framework that describes what is a research engaged organisation. What does it look like for a health board to be really supportive of and engaged in research? And we're currently using that. I'll come back to that at the moment. We've also worked with a bunch of other people to help them to develop their research and innovation strategies. We're doing some work with Public Health Wales on that. We've worked with Social Care Wales on that. We're working with colleagues in the nursing and allied health professions on a review of and action plan for research in those professional groups in Wales. So there's a great deal of that, trying to make sure that research figures in the strategies and plans of other important organisations in Wales. We've also done a lot of work to promote identifying and meeting research needs. That's our own prioritisation exercises, but also work we've been doing with the Healthcare Research Wales Evidence Centre, which I'll come to, I think, on one of my later slides. And the input we have to other funders like NIHR, where we can put research priorities to them and they will feed into their commissioning process, and then we can see that research produced, especially now that we have, and I'll refer to this again briefly, expanded access for Welsh researchers to NIHR funding programmes. So that's number 1, setting the agenda. Number 2 was funding and organising research. We've reorganised our own funding schemes to try and bring them together and create more opportunities for calls. We have worked with NIHR to extend access to their schemes, which are much, much larger than ours and have a lot more resource behind them, to Welsh researchers. So the NIHR programmes, some of which used to only be open to researchers from England, are now open to researchers from across all 4 nations of the UK. And that is a fantastic development, which we're really excited by. And we're in the middle of a review of all our funded centres and units. So we provide some core funding to about 17 centres and units around Wales, Economics Cymru, the Centre for Trials Research, Decipher, which does public health research, and so on. And we're midway through a review of those centres to consider whether to renew their grants. And we're also going to be in 24 issuing some new opportunities for funded centres and units. So that's all quite exciting. That's point 2, funding and organising research. Aim 3 on building capacity and capability. I've got 2 slides on this because there is quite a lot we've done. We have launched the Health and Care Research Wales faculty, which brings together all our award schemes for personal awards for people's career development, things like fellowships, research time awards, PhD awards, and so on. And there's been a lot of work to both strengthen those programs and invest more in them, but also to do much more to offer mentorship, career support, and things like that to researchers. We want people to have the opportunity to have a really great research career and stay in Wales to do that. The other thing that I wanted to mention is that we've been working on the R&D framework that I mentioned earlier, which came out as Welsh Health Circular. That's really helpful in saying, this matters, and it has some official backing behind it. And we are currently doing reviews with all boards and trusts using it. We're also doing quite a bit of work around clinical research delivery in Wales to see what we can do to improve its efficiency and productivity and make it better coordinated, so that when clinical research is opened in Wales, it's kind of opened once for Wales rather than having to be separately opened in many different boards and trusts. Second slide, we have done quite a bit of work to invest more in social care research in Wales, including commissioning a new centre based in Cardiff for adult social care research. And as I mentioned earlier, working with Social Care Wales on their programme of research and innovation. And Alex is leading a lot of work for us on using data for health and social care research, where we've got a great asset in Wales, in Sale, in Swansea. We have better linked data for health and care research than any of the other countries of the UK. And there's lots of interesting developments which may see that data used much more productively in the future to support clinical research, and could say more about that if people have questions on it. And my last aim, the fourth aim, was making the research useful. And there, our biggest development has been the investment in the Health and Care Research Wales Evidence Centre team. So during the pandemic, we had a COVID-19 evidence centre that was doing a lot of rapid evidence synthesis and review on questions that really mattered to the people who were having to make decisions about pandemic health and care services, about the control of infection and so on. And we've carried that forward. And the team now, who work across a number of organisations, coordinated from a small team in Cardiff University, what they say they specialise in, they absolutely do this really well, is good questions answered quickly. So they can bring evidence and research to bear on a question that policymakers in government or people in the NHS need to make decisions about. And they've, if you look at their website, you'll see that they published a stream of really useful reviews which pick up those topics and publish their evidence findings. There are some cross-cutting themes right across the plan. One of which is the involvement of patients and the public. This forum and all the work that Alex and many other colleagues in Health and Care Research Wales have done, developing things like the Period tool and promoting its use, the work we collaborate with NIHR on other resources as well. The other two cross-cutting themes running through it are communications, engagement, and raising the visibility of research for people and public and communities, but also for stakeholders in government and others, and work around equality and diversity and inclusion, where I think pretty much all health and care funders, research funders, have recognised over the last 3 years that there is a lot of work for them to do, both to make sure that their funding programmes and other activities represent the real research needs and interests of the diverse communities they're there to serve, and also recognising that they have a real responsibility for diversity in the research community, and thinking about how they use their position as funders to encourage and promote and support equality, diversity and inclusion in institutions like universities, health boards, trusts and others where research takes place. I'm going to finish with just, there's still a lot to do, basically. Funding is still a challenge. I mean, it's also worth saying, this is all happening in the context of a health and care system in Wales, which is really under the cosh. I mean, that's not saying anything terribly controversial. We all know that the health and care system post-pandemic is really challenged to recover its position, to treat backlogs, and to treat increasing demand. So it's a system under strain, and so everything we're doing sits in that context. We have to recognise it. We're still, fighting for funding for health and care research taking place in Wales, and that's something where a lot of the funding is at a UK level, and Wales traditionally has not had as much of the funding as some other areas in the UK, so other countries and some regions of England. So that's a fight we continue. There's lots of opportunities around industry-funded research, where again we're trying to push to make sure Wales plays its full part in a lot of developments which happen at a UK level. I've mentioned the work we're doing to improve clinical research delivery in Wales. That's a real priority for 2024. I've mentioned also the work on using data for research, where Wales is absolutely a leader in the UK and others are catching up. So we want to maintain our progress in that area. And finally, I think, you know, we published the plan in March. We are starting work on our action plan for EDI, and I think there's a lot for us to do in that as an area. So if you want to know more about the plan, it's on our website, and there's some further details about our progress in the annual report, which came out in October. But I'll stop there, Alex, and really happy to answer questions or hear people's views.
Great. Thank you, Kieran. So I think I would encourage everybody, if you do have questions, please start putting them in the chat. I can see that some are going into the chat. I'm going to start just to give people some time to put their questions in with some of the pre-submitted questions that we have. I have to apologize. I don't know who submitted these. They don't have names next to them. So if you want to claim your question in the chat, by all means do. So the first question, Kieran, that kind of we had was about sort of the balance of our priorities when we're looking to fund a project. So how much do we value how much it's going to cost to fund versus the aim that it can have around influencing or improving a health and social care condition or service?
Okay, I mean, you know, Alex, we work in a system that's funding constrained, so money always matters. But I think there's probably three priorities you look at as a funder, and I don't think we're unusual in this. Priority number one should be, is this research needed? You know, is it meeting an evidence gap? Will it make a difference? Will it be used to create change and improvement? How will it contribute to moving forward what we know and therefore do about a particular disease area or a service or whatever? So question one is this research needed, and what's the need? Question two, then, I think is this good research? You know, so in other words, are we confident that the people who are going to do the research have got the skills, capability, and so on to do it? Is it good methodologically? Is it good science, basically? So first question is it needed? Second one is it good science? I think the third question then is it cost effective? Because you know, you could have cheap research that isn't good science, or you could have cheap research that doesn't really meet a need. So it's in that priority order, I think, and that's what most funders would say.
Thanks, Kieran. That's really helpful. So our second question was from a colleague that kind of is really grateful for some of the engagement that's been going on around providing support and resources for third sector organizations getting involved, both through involvement, but also kind of driving some of the research activity themselves. So the question is kind of, are we planning to kind of expand on this type of work and how we might be going to do about that? So Kieran, you might want to say a few things and I'm happy to chip in then as well.
Yeah, I mean, I thought that was an interesting question because I wasn't completely sure what lay behind the question. So I don't know if the person who asked the question is in the forum and wants to come in and comment on it. I think that the loudest voices in the room when you think about research priorities and what you're going to fund and so on are often the research community, the researchers, and that's completely understandable. So we as a funder have to work really, really hard to make sure that other voices are properly heard. And you know, all the work that people have done shows that when you involve patients and the public in setting research priorities, you often get very different answers from the answers that you would get if you just asked the research community. So that's, I think, why it's really important that we try to make sure in everything that we do, there is a public voice. Making that work and making people, enabling people to really do that in practice is a work in progress for pretty much every funder. Alex, do you want to come in?
Yeah, so I think I was just going to expand on what you said. So I think, you know, the way in which our prioritization exercises involve the public, and I think, you know, we have almost a rolling open call for people to join that group to be part of those ongoing prioritization exercises, you know, demonstrates that we are really committed to making sure that public contributor voice is part of those discussions and prioritization exercises. And I think the other thing I was going to say is, you know, really to commend Pete and the team at the Health and Care Research Wales Centre. You know, our asking them for a while to start focusing more on outreach type work, going out to communities and talking to them about what they need from the research and what it would take to get them involved. And Pete and the team have been doing a great job in starting that. And I think what we do need to do now, as we start looking forward to what comes next in terms of our public involvement plan, is what that needs in terms of to do it more constructively, to do it more formally, and what resources might be associated with that. So I think that's something that, you know, we'd like to kind of keep in our minds when we're looking at kind of where we want to go next with a Discover Your Role plan, which will be at our next meeting in kind of March time. So the third pre-submitted question, and then I will try to start picking out questions from the chat, was related to public contributors and the knowledge and skills that they might bring. And the question specifically asked about kind of, you know, the growing importance or of artificial intelligence coming into the research space, and whether or not public members should be know or supported to understand some of the issues around that. So again, you know, Kieran, if you want to say something generally, I'm happy to contribute to this one too.
So there are so many interesting questions everyone start to ask around AI, that it's such a bandwagon, and there's a lot of noise and not as much signal perhaps as you need in all the debate and the noise and so on. We all watched that international summit on AI and safety last week with a degree of incredulity, I think. Having said that, you know, some of the developments of AI are really, really interesting and important from an EDI perspective and from a patient and public. I was talking with a research colleague recently about the work they're doing on pattern recognition using AI, and he made me aware that they found that AI systems looking at patient data can identify race, even if race is not included in the data. So AI systems, machine learning systems, can identify racial groupings, even though that isn't in the data. And it's to do with the way in which pattern recognition works. I think we've all seen, you know, concerns about the fact that AI systems in, for example, breast screening, are trained on a data set that comes from people who have had X-rays and have had breast screening. And then when you apply that data set to other patient groups, it may not work as well. You know, there was all the discussion during the pandemic about oximeters and the belated recognition that they've been developed and tested, and all that work had been done. But we hadn't really answered properly the question of how they work with people who didn't have white skin. And the recognition that actually they weren't as accurate with non-white patients or members of the public. So I think there's a really interesting way in which technology often leaps forward, and we have to keep asking the question, yeah, but how does that work for our communities, and what might it mean? And sometimes those answers are unexpected. So that discussion I was having a colleague about AI and racial groupings surprised me, because I hadn't twigged at all that the AI could intuit things from data sets which was not necessarily in the data set explicitly. I'm not sure that's a very good answer, but I'm not sure I have a good answer to questions about AI.
I think, you know, for me, expanding on your point, that there's two things. So there's one about you've kind of demonstrated, you know, the importance of the representativeness and the diversity and who is part of clinical trials. And I think, you know, the role that public involvement can play in making sure that those issues are, you know, kind of thought about at the design stage and challenged by kind of people outside of the kind of the research bubble is a really important role that public involvement can play in influencing that agenda. And I think secondly, more to the point of kind of the knowledge that we expect from public contributors and the support that we need to give them, I think it's a really important question for us thinking about how opportunities for public contributors are designed. And so rather than assuming that we're going to find a member of public that, you know, has spent their spare time boning up on AI, which is probably more than I've done myself, or comes with some sort of pre-existing knowledge of it, is really kind of, well, it's not a real accurate representation of how you're going to get a good public contributor in. So I think it's going to be opportunity specific in terms of the knowledge that's going to be important. But I think researchers increasingly need to think about not that you're going to find a public member that's going to bring all of this sort of pre-knowledge with them, but how you support them to understand the issues so they can play their involvement role properly. And I think when we start thinking about how involvement opportunities are designed and offered through Health and Care Research Wales, that level of support and expectation is going to be really kind of important part of it. So I'm going to move on to some of the questions that are coming through, and hopefully we'll get through as many as possible. The Zoom chat bounces up and down every time somebody puts a new question in. Sorry, I had a question, it's gone. So I think the first question that I spotted was from Jeremy, and it was talking about access to Welsh data and his kind of experience working with some teams in England that struggle to get hold of Welsh data for their research projects, and what we can do about that.
Alex, you might be better placed than me
Yeah,
to answer that question.
I'm more than happy to.
You
So
lead
yeah,
on our work, and you know more than I do about the efforts to harmonise data access across the UK.
Yeah. So I think there's a couple of things here. So one, Kieran, you've already mentioned, we have the SAIL data bank, which is kind of an incredibly rich, powerful resource for research and data-led studies. Yeah. And so the one element is about how we make sure that is promoted and networked into kind of the wider system. And I think the second element is that, I'm familiar with some of the experiences that Jeremy's described, because I think our digital healthcare organisation, Digital Health and Care Research Wales, they have had very little capacity to operate as a research functioning organisation for so long. And that is one of the priorities that I'm investing in at the moment, to build up their research and innovation team so they can be more engaging and more responsive to requests from within Wales, but also across the border, that we need that kind of access to data. Often, the patient consent is already there, but they just don't have the processes to kind of get that data flowing and released. So I definitely know that's happening. Anthony, I've just seen your comment, and it's really important. So the Cathy Sudlow review, which was commissioned, it was an English-focused piece of work on reviewing how data within the health service can be made available more freely for research purposes. One part of it has a UK-wide, sponsored by all of the chief medical officers in the UK, and that is looking at mapping which data flows are currently exist in each nation, and how easy it is at the moment to actually access them for research purposes. I'm meeting with Cathy Sudlow on Friday to talk about some of the issues that she's hearing in the system about the Welsh data environment. So it's a very live topic at the moment, and hopefully we'll be moving forward to deal with some of those things. I hope that is answering your question, Jeremy. So Alicia is asking about the eligibility for the funding schemes. I'm really sorry, people. Every time somebody writes something in, it jumps around and I lose where the question is. Where's the question
gone? I can see the question from Alicia, so
yeah.
help me out. It was our fellowship is only open to postdoc researchers, e.g. people with PhDs, because some people come to research via non-academic routes and so on. We tried. I can't speak with authority without going to look about the funding criteria for all of our personal award schemes in the faculty. But what we've tried in bringing them all together within the faculty is to make them as open as we can, and to provide opportunities for people at every stage in their research career. So if you are going to pursue a research career, you need a research training. In order to do good research. Like, you wouldn't send someone off to do surgery without giving them a proper surgical training. Well, don't send someone to do research without giving them a proper research training. And that mostly takes place through a PhD, not exclusively, but mostly that's how people get the research training, or through an MD for some doctors. So, we try and make the schemes open. We're also trying to be really clear about making sure that we are fair in assessing the CVs of people from different backgrounds. So, someone who's come through a medical training may have a CV that on the face of it looks like they've got more research experience because of the nature of that medical training than someone, say, who comes from a background in one of the therapies. And so we're trying to be fair in assessing CVs from different backgrounds and disciplines, and to think really carefully about capacity to benefit. But the aim with the faculty has been to have schemes at every stage, all the way from providing people with opportunities to access a taught master's in research, to have some time for research, through to doctoral salary level doctoral awards, which we've introduced for the first time, through to postdoc awards, and through to advanced fellowships. So the aim is to try and have a kind of pipeline, if you like, so that people can enter that and leave it at different stages, but so that we're supporting people right across the research career pathway. I think we have in the past in Wales underinvested in creating the people who are going to be the sort of research leaders, the chief investigators, the achievers of 5 years, 10 years, 15 years time. And so it's a bit like a football academy, isn't it? You have a broad recruitment strategy, you provide as much opportunity as you can, and that helps to produce the people at the apex who are going to be your future research leaders, while still supporting people right across the pyramid.
Thanks, Kieran. So I think John Ganders had a very similar question, which I think you've also answered. There's also a question from Debbie about the primary care research group, which I think colleagues have very helpfully answered in the chat. So we might skip on that one as well. Let's have a look. It says, comment from Mari. Oh, sorry, it keeps disappearing from my screen. Is Health and Care Research Wales somehow able to capture the way in which public involvement in research contributes to NHS Wales service improvements, including things, for example, reduction in waste? And it's difficult sometimes for research projects to get that information back as to what the impact it's had in the service. Is there anything that we might be able to do in relation to that?
Yeah, I don't know. I mean, the earlier discussion about PIRIT is a good example of that attempt to be clearer about the impact of public involvement work. So I suppose I'm going to push the question back to you, Alex, or to one of the colleagues involved in the development of PIRIT, and thinking about whether that helps us to do what I think Mary's question's getting at, which is that issue of how you show that research has led to real improvements.
And I think it's gone.
Well, I was just going to say, and of course, that's not just researchers' responsibility. I think researchers have got a job to do in disseminating their findings, in promoting their uptake, in going and presenting and talking and so on. But it's also for the sort of system, the health and care system, and for the clinical community to pull those innovations into practice. So it's a kind of shared responsibility.
And I think, one of the roles of the communications team, they are often desperately looking for those kind of case study and impact stories. So I think, as you said, from a public involvement point of view, I think the PIRIT tool gives a really helpful structure to how we're capturing that more accurately. And then, how we're able to kind of reach into the system and draw out some of those kind of examples of what impact it's had is really important. Sorry, I saw there was one final question from Alicia. Sorry, Alicia, did you want to comment on the PIRIT tool itself?
Yeah, well, not the tool itself, but I think that perhaps what I'm reading as a wider question within that one that was just asked is that the PIRIT tool is about capturing the impact of the public on the research itself. That I think that what this question also relates to is the ongoing impact out in the world, and that is something that can be really hard to capture. Sometimes that's because the researchers have moved on, and actually what you need to do is actively be asking people, right, this is our research, what have you done with it? Is it on the shelf or are you practicing? What's happened now? And in my own experience as a researcher, if that's your piece of research, you need to be going out and asking that question repeatedly to find out what difference it's making this week, next week, and the week after. And you're reliant on very busy people to respond, and sometimes they just don't know. So I guess I'm reflecting that there are challenges in that ongoing impact.
Definitely. Thanks, Alicia. So I think we're going to take one final question. And I think, in fact, it is your question, Alicia, which again, I just had and now has disappeared. To what extent do we feel the current research funding approach is able to support sustained and reciprocal relationships with communities that is genuinely people-centered research?
I think that's an interesting question. So the way we fund research is not just Health and Care Research Wales. It is, the way research funders fund research is often very project and program based. And so the challenge, I think, for researchers and research teams is to kind of build a sustained capacity and capability, and that includes their capacity and capability around communities that they're serving, around patient and public involvement, and so on. So some of what we do, I think, in Health and Care Research Wales helps in this endeavour. For example, the core funding we provide to centres and units includes quite a chunk of resource to support them in having a long-term programme of patient and public involvement and engagement. So I think that's a good thing. But the downside of a competitive, peer-reviewed, project-based system of awards is that they're all time limited. So people get chunks of money for doing a particular piece of research, and trying to build a sort of sustained research team and centre an effort around that is a challenge. And the PPIE aspect of that is one part, I suppose, of the challenge. Don't know if that's what Alicia was getting at with the question. But I do think, as a funder, we're quite forward-thinking in providing that centre and infrastructure support for PPIE.
Thanks, Kieran. Okay, so we are overrunning a little bit, but I noticed that Anthony's got his hand up. So I will come to Anthony, and then I think we'll wrap this up because we are keeping you from your break.
Hi. Sorry, I got two questions, if that's okay. Right. The first one is, there wasn't any mention of how to bring in private enterprise into the health and care research efforts. Now, obviously, from my background is from clinical science, commercial science. So I've got skin in the game on that. But obviously, there's a lot of spin-outs now from universities, which once it's spun out, do you lose control? And that's an interesting dynamic because you want to sort of have some influence on what happens after they're spun out from the university. The other thing is, like, for instance, I worked at Siemens Healthcare, and they create diagnostics. You want the right sort of diagnostics to help the right sort of people, if you see what I mean. So that was the first question. The other question was, there's lots of in the faculty, there's lots of support for PhDs and sort of academics. What about people who aren't academic but are also contributing to the good fight through PPI research? You know, there's a lot of people that could do with support to sort of expand their usefulness in the PPI space, critical thinking, the list goes on. And there's never any mention of that. And I think that you're missing a bit of a trick there. I mean, I've got those skills, but even I would be happy to sort of have them bolstered through a sort of career path. So have you thought about that?
Okay.
Is that in the plan?
The first one's easier to answer than the second, because there's quite a bit in the plan around industry engagement, and it's actually, there's a huge push at a UK level around better industry engagement. Some of that is about, just getting industry funded research done, but it's also about, the more proactive engagement with industry, pharmaceuticals, medical devices, diagnostics, and so on getting the right innovations into health and care systems. And also encouraging, doing something that in the jargon they call demand signaling, which is actually, getting those private sector partners to develop the innovations that the NHS actually needs. So there's quite a lot in it on there. On the second point, I mean, the faculty is doing, obviously, is supporting things like PhD awards, which are not just for academics. I mean, practicing clinicians, clinical scientists, all sorts of other people have opportunities to pick up those awards. And of course, it's in the social care space as well. So I think we've had a really interesting transition in some of our social care centres and units, people coming in basically from practice background as, say, a children's social worker, doing a PhD or doing a master's, progressing on and becoming active researchers, and us trying to work to support them in doing that, but also continuing to have the engagement and career in social care organisations. So there's quite a bit going on around that. I think less around public and patient partner contributors, but I think the purpose of forums like this is that if there is a development need, it might not be particularly in the faculty, but it might be by the PPIE team at the Support and Delivery Centre, then we should be trying to respond to that. Because I think we all recognise that people who get involved as members of the public or people from the community in research, they need a lot of support and this dreadful phrase, kind of scaffolding, if you like, to enable them to make a proper contribution and not to be involved in a rather tokenistic way. So I think there'd be an open door to suggestions offline about other areas for kind of training or support or whatever.
Thanks, Kieran. And Anthony, do feed those questions into the breakout rooms, because I think, we will be focusing on what are the gaps or kind of where can improvements be made in this space. So we've run over a little bit, but I wanted the opportunity to kind of put questions to Kieran. Thank you so much, Kieran. I know that you're off to present somewhere else now. So, and everybody, we are going to have a break now for 10 minutes. So we will return at 11:25. Thank you, Kieran, and we'll see you all the other side of the break.
Thanks all.